Managing Test Anxiety, presented by the University of North Georgia's Student Counseling Center. Test anxiety is a common experience for college students. Let's differentiate between earned and unearned test anxiety. If you didn't adequately prepare for the test, it's understandable that you could be anxious about it. This is earned test anxiety, and it's a normal response to you not being fully prepared. A lack of adequate test preparation is the #1 cause of test anxiety. Assess your study skills. The amount of time put into studying isn't the only factor to consider. How effective and efficient is your studying? Ask professionals for their input, such as an academic success coach, a tutor, or your professors during office hours. Talk to them about how you study, and see if they have recommendations for improvement. Becoming confident in the material can prevent test anxiety. Unearned test anxiety occurs when you're having difficulty performing well, despite being prepared and knowing the information. Some people experience this as their mind going blank. Others experience sweating, and rapid heart rate and breathing. Our video "What is Test Anxiety" has information on symptoms and why our bodies respond in these ways. First, understand that you are capable of managing your anxiety, but that there is no magic cure. You will need to learn skills to reduce your body's physical response to anxiety, so your thinking brain can regain control. You will need to work to change how you think about yourself and the situations that you face. This will require effort and regular practice, so that you feel confident with these when it's test time. To resolve anxiety in the moment, a powerful physical technique is breathing exercises. One method is circle breathing, which involves inhaling through your nose, and exhaling through your mouth. Ensure that you are taking full, deep inhales, followed by fuller, deep exhales. You may do a few breaths in succession, before transitioning to taking a deep breath once every few minutes. Doing these too quickly can increase anxiety, so ensure that all inhales and exhales are long and full, with pauses between. You can incorporate a cognitive technique called visualization into your breathing for added effectiveness. This entails using your imagination to place yourself mentally in your happy place. This may be on a beach, listening to the waves crashing on the shore. Imagine what your happy place looks, sounds, and smells like. Use your senses. Close your eyes while you breathe, and be there. Additional physical techniques include grounding exercises. Use each of your senses to ground yourself in the current moment. What can you see? What can you hear? Maybe the air conditioning, or the shuffling of papers. What can you smell? Maybe someone has on lotion, or you smell the rubber of pencil erasers. What can you feel? Your body in your chair? The smoothness of your desk? What can you taste? The remnants of your last meal or drink, or perhaps your toothpaste. Delving into these senses will force your body to recognize that you are physically safe, and turn off the anxiety response. Do these things intentionally and slowly to meaningfully engage your senses. Additionally, there are some physical aspects you'll want to attend to on test day. Pay attention to what you're consuming, and any exercise you engage in. Consuming stimulants, such as sugar or caffeine, can increase anxiety symptoms. While they may help you feel more awake, the trade-off is that you won't be able to use your knowledge because anxiety will be running the show. If you haven't eaten properly, this may also contribute to your test anxiety. When you're feeling sick, it's hard to be at your best mentally. And nausea can be a symptom of anxiety, and reinforce the feeling that something is wrong. You can exercise before your test, as endorphins provide a calming effect. Having a calmer body entering the test can limit anxiety's impact. Working to change how you think can help both in preventing and resolving anxiety. The truth is that your anxiety is coming from you. It isn't about picking the right professor or the right class. It's about looking at your own attitudes, expectations, and perspectives, and being willing to change them. The most powerful thing that you can do to change test anxiety is to change your mind, literally, change the mindset you have when approaching things. Is your outlook positive, or negative? Are you willing to put yourself out there to grow and succeed, knowing that setbacks are not only possible, but a part of the process? Our mindset can make things easier or harder for us to succeed. Identify what negative messages you're telling yourself walking into the test. Are you saying, "I'm going to fail this test, I always do. I'm really bad at this. Why even bother trying?" Unfortunately, these are not unusual messages. You need to be willing to stop talking to yourself in such a negative way. Redirect yourself to say, "I am doing everything I can today to help myself be successful. I'm going to do my best. I am capable of doing a good job." Realistically, there is a lot of area between acing a test and failing it, and most people fall somewhere in the middle. However, our minds tend to sit in this all or nothing mentality. Be compassionate with yourself. Try saying, "I may not do as well as I would like to because this is hard. But I'm going to do my best." This is a much better message than, "Well, I guess I'll fail." What you think most, happens. If you think you're going to do poorly, you're more likely to engage in behaviors that will make this become true. You may not study as much, why bother? If you're thinking about failing, you'll get stuck in that mindset, and make it a self-fulfilling prophecy. You can change the outcome with your thinking. Positive thoughts create positive emotions. You'll feel more competent and confident. You'll view fewer things as impossible or improbable, which will lead to you working more to reach for those goals. Because you believe your efforts will be rewarded. Imagine how powerful it would be to envision yourself passing the test. Envision yourself putting in the time and effort, being calm during the test, and working through each problem. Our negative self-talk messages are called cognitive distortions, because they take reality and distort it. Some examples of cognitive distortions related to test anxiety are: "I don't know anything, what's wrong with me?" Well, you don't know everything, nobody does. But, you do know quite a bit. You're just having trouble accessing that information because of your anxiety. Nobody else seems to be having trouble. You're not the only person struggling in this class, or the only one anxious during this test. "I'm worthless. I'll never amount to anything. My life is over." This is a test on class material, it's not an evaluation of your worth as a person. If you fail this test, there will be other tests. Careers aren't defined by a single test. You can try again, so take some pressure off yourself. As you may have noticed, these thoughts tend to snowball off each other. Just because we don't know something on one test, doesn't mean that we won't amount to anything, or that our lives are over. Work to replace your negative self-talk with positive self-talk. Tell yourself, "I'm smart and capable. I can get the right answer. I'm meant to be here, I've earned it. I can pass. I don't have to be perfect or get every question right. I just have to get most of them right. I will do well on this test, but even if I don't, there will be other tests." You can't control how the professor writes the test, but you can control how you choose to approach it. Acknowledge what you can and can't do. Recognize that carrying all of this fear about things out of your control won't help you. Focus on the things you can control. Thank you. Please contact our office at 706-867-4649 4402 for additional support.